blocking out all we can see. We ask ourselves the same old question, who will be there for me?
Hello, this is Daryl Pillsbury along with Richard Davis for another healthcare update. Today, because we have the governor's race coming up and we have the report due out to this new legislature that will be elected, I thought maybe today, Richard, we'd hit on a little bit of the gubernatorial candidates. Not that we're endorsing anybody, although you can probably tell which way I'm leaning, but we just wanted to kind of give folks, there's quite a little bit of a difference between the two main candidates running for governor, and we thought we might get into that. Whoops.
Yeah.
Go ahead,
Daryl's
Richard.
falling apart. All right. So, as Daryl said, we have to make it clear we're not endorsing anybody, and these are our personal opinions for the most part. So, what we're going to try to do is show you what the difference might be if one candidate, Brian Dubry, or the other candidate, Peter Shumlin, becomes governor in terms of health care. So, let's start out with something that I find quite revealing.
Yeah, gee, right. You don't have to go real far into this.
All right. Well, I figured, nowadays websites are important, and they spend money, and they want you to look at their website. So, and they all have a section in their websites called issues. So I went to Peter Shumlin's website, and he has quite a number of issues that are quite diverse: job creation, environment, green energy, education, healthcare, equal rights, local farming, seniors even, okay, which is another healthcare issue. So that's fairly broad. So I expected to find something similar at Brian Dubry's website. Well, I didn't. What I found was, here's Brian Dubry's issues. It's all about jobs. So everything else relates to jobs. Cutting taxes, he wants to cut taxes, control spending, reform the regulatory procedures, and growing Vermont's green economy. That's it.
There wasn't, wait a minute, Richard, let me just, health care.
Yeah, I don't see it.
There's no health care?
No. So we're going to talk about health care, but this is very odd. Well, not odd, but it tells you that at least, we can't draw complete conclusions from this, but it appears that health care is not on his radar, on Brian Dubry's radar, as it's not an issue that's important to him. When somewhere between 10 and 15% of the population doesn't have access to health care, when another 15% of the population can't afford to even use the insurance they have, and we're struggling to keep alive, basically. And on top of that, this is what I'd like you to talk about, Daryl, too, is that this is what I don't understand. Brian Dubry talks about jobs. And surely, and Peter Shumlin does too, that jobs are something that are critical, and we need to stop having the bleeding of young people moving away from Vermont. We have to attract businesses and that kind of stuff. And Shumlin and Dubry are pretty, they say similar things on that kind of stuff. But one thing that needs to be recognized is the fact that one of the prime drivers keeping the cost of running a small business in Vermont high is health care. And Shumlin is approaching the jobs issue from a healthcare perspective and saying we need to lower the cost of healthcare in order to promote small businesses. But so, why don't you talk about that for
Well, that's definitely true. And one example that I can give is for a auto manufacturer in this country to produce a car, it's $5,000 more to produce that car than it is in Canada, strictly because of the cost of the healthcare. So I think it is a huge economic boom. It's something that does need to be talked about. And the jobs that come out that surround the healthcare field now are huge and growing all the time. So I think it is a big player. And when they talk about it's all about jobs, I would have to say Dubry's running the same sham that Governor Douglas ran. Jobs, jobs, jobs. When we actually lost more jobs than we did while he was in. And a lot of jobs he created, especially in government, were upper level, and we have a lot more jobs in the field of, well, he took the press corps and made them all his own spokespersons for each one of these agencies of his. So anyway, jobs is one of those, everybody wants to hear about jobs. That's what every politician says. Well, it's about jobs. Well, how are you going to do that? Well, and I think Shumlin does have a path to get there, and part of that path is using healthcare system, which we definitely need.
I don't understand how a candidate for governor
doesn't even have it on his list.
Well, can talk about job creation and not mention the biggest driver of healthcare costs is the rising cost of health insurance. Okay, anywhere from, it could be anywhere from 25 to 40% of a budget of a small business can be dedicated to healthcare. Now, Shumlin's approach is what Doobie would call radical and the government take over healthcare. And actually, what it is
cost control.
Yeah, at least from my perspective, it is something that actually lowers the cost of doing business in Vermont. Yeah. But in addition to lowering the cost, and this is about jobs too, is that imagine an employer who no longer has to be a benefits manager for his company, and the people show up for work, and they're there because they like the job they do, not because their boss provides the best benefits. How many people work at jobs not because they don't like the job they're doing, but they're doing it because that employer has great benefits?
Well, there's some of us who, I happen to love my job. I have great health care, but I can't go and pursue something else that I would like to do, my own little business, because of the cost of health care. That is one of the things I've had to think about for years. Also, when we get back to creating jobs, like you were talking about, I think, and now people who disagree with what I feel will say that we'll lose businesses. You may lose a couple. I'm not sure. You may lose dozens. Who knows? But I would be willing to bet that we would gain so many more than when we lose, for the simple fact of what you said. Now, a company could come in and say, okay, this is great. We don't have to worry about health care coverage. All of our employees can have health care. I don't know. For me, it's a no-brainer. But like I said earlier in one of our other shows, the difference between folks that disagree with what I feel is very fundamental. They don't have the problem with healthcare being based on the market-based for-profit system. Me personally, I don't think it should be that way. I think it should be the government should be taking care of people. Quality of life for a lot of folks that I know that don't have health care is much different than the quality of health for those who do. And to just send them out and let them try and fend for themselves when they're in pain every day is absolutely ridiculous. And I found it very odd, too, that Brian Doobie didn't have one thing in there about health care. And when you look at the polls, it's in the top 3 of what people are
and it has been for decades, actually.
I think he's afraid of that issue, personally.
Well, you're probably right from a political point of view. Now, here's something that even scares me more, other than the job part that he doesn't mention, health care. This is, to me, more frightening because this goes after the most vulnerable. Another one of Brian Doobie's issues is to control spending.
Right.
And where he's focusing totally on nothing but government. Of course, as Daryl said, if he really wants to downsize government, how come, they could save $1 million by getting rid of all the PR people in the agencies, and Douglas wouldn't do it. But
14 of them.
Maybe Doobie would do it. That's $1 million. Well, we won't even get into that because that's chump change anyway. However, well, not really. It's $1 million in Vermont.
Well, the first job is going to be to find $120 million, Richard.
Yeah.
There's one.
Okay, but here's what scares me. If Brian Doobie were governor, state government would have to live within its means and re-examine priorities, right-size state government, and what else he says is, we simply cannot continue to increase state spending while we're losing jobs. Increasing taxes only quickens the downward slide. So really what this is code for cutting Medicaid, cutting all the entitlement programs like Medicaid, VHAP. All he talks about is cutting, but he doesn't look at any kind of revenue or any kind of balance in that kind of equation.
Right.
And what does that mean when you say you're only going to cut taxes and you're only going to downsize government? who hurts the most? Well, mostly the people that don't vote for you because they're so disenfranchised. And that's easy to go after those people. But what this really means is that if there's a program that's either level funded or gets a cost of living increase, like some of the home-based programs in Vermont, you can imagine Doobie, and a governor has a lot of power. He can, it doesn't have to go through the legislature. They can do a lot of this at the policy level. And so there could be a program that he doesn't like because he thinks it spends too much money, and he can just get rid of all the people running it. I mean, this is scary stuff. Now, this is not to say that Peter Shumlin isn't perfect, or is you know what I mean. Anyway, you know,
he's not perfect, but I can say this about Shumlin: at least he's been working for health care since I've known the man. When he took the time off from being in the Senate, he was a advocate trying to get some of our health care programs going here in Vermont. He's got good working relationships with our congressional delegation down there, which I'm sure Brian Doobie does too, but I don't think it's quite as close as the one that Peter has, which I think is a big plus for us when it comes to getting waivers, whatever it is we're going to need when that new, with the new...
when the study comes.
Study, thank you.
Well, let's turn to more positive then and say, all right, we just trashed Brian Doobie.
Well,
okay.
We did a little bit, which we were going to try and not do that, but the first 15 minutes, that's what we did.
Well, I think.
But I think that it's so clear, Richard, and for two people, for me, I won't even talk for you, but for me, who's been doing this since '92, and I know you've been doing it for much longer, when you come across these folks that are still saying the same thing and nothing's changing, why can't we try my method? Please. Try it for a little while, and then we'll get back to you if it's not working. I mean, we tweak things all the time. Act 60 got changed a couple times. To not even have it in your
it's frightening.
top, it is frightening. And I'm taken care of. I'm well. Listen, me and my kids, and I've said that many times, I've got great insurance. I work at a hospital. My kids are taken care of. This is about you folks. This is about having a quality of life. And you better pay attention because right here, this election is going to be a huge, huge factor in how we're going to have health care in the state of Vermont, in my opinion.
So let's turn a little more positive.
Positive stuff now.
Let's look at Shumlin, okay?
Yay!
All right, all right. Now, okay, what is Shumlin's idea for health care? You know, let's talk about that, because Peter Shumlin in the primary very strongly articulated a position that he was in favor of single payer. Okay, it's a politically very difficult thing to do. So, first of all, we may have mentioned this in other programs, but let's sort of give the definition of what Shumlin's going after first. What does single payer mean? Well, it means a lot of things to a lot of people, but essentially, what single payer means is that we get rid of almost all the private insurance companies, and there's one company that insures everybody. It could be the state, or it could be a private insurance company. They don't make the rules. The state makes the rules. The state can either be the insurance company or they can farm out the administrative costs. So when they say single payer, there's one entity paying. So in most estimates are that cuts your administrative costs in half. It's an uphill battle. It's extremely difficult. And then Daryl mentioned the waivers. In order for this kind of program to work, you need to take all the money that's coming into Vermont for health care and put it in one pool, and in order to do that, you need special permission from the federal government. So we won't get into all that, because we're talking about politics. But that's essentially the single-payer approach. Now, Shumlin, this is very risky stuff politically, I think.
It is.
You know, even though there are a lot of single-payer supporters in Vermont, a lot of people hear those words. It's very polarizing. So I think it's consistent with Shumlin's approach to politics, at least what I can see, is that he took on gay marriage, which potentially was very polarizing. He took on Vermont Yankee, which was polarizing.
And impeachment.
And impeachment and gay marriage, and now it's health care. So from a how do you look at this politically, Daryl, as Shumlin as a single-payer supporter? What are the politics, you think?
Well, For me, are you kidding?
No, for the state, for his campaign and all.
Well, for the state, well, first off, if someone happens to be elected governor, and I would assume the Senate keeps the majority that it has, which you don't know, but it's pretty big. The House would still probably keep its majority. You now have all branches of government in Vermont on the same page, because the Democrats have been talking about this for a long time, and I personally would definitely hold their feet to the fire on this one. Not that it means it's going to happen.
Right.
I mean, there's
Well,
still
they're not
politics.
they're not all the
They're
same.
not all, and it's still a lot of politics. There's still a lot to be done. You
Right.
still got to work with Washington. I mean, but for me personally, seeing everybody in church, there's a reason why in the state of Vermont we constantly come out as the top 1, 2, and sometimes 3, but 1 and 2 for our healthcare outcomes for our children. It's because we have Dr. Dinosaur, state-run program. Okay, there you go. For people who say, "Oh, the government can't run anything," there's one we run right here in Vermont, and we get great results from. We do. The VA. I mean, there's already so many things that the government's already running with healthcare that I just see this as a must. First off, as somebody who sat there and tried to deal with the budget, I can tell you what, this is a driving factor. Healthcare costs. It's a driving factor, folks, on your taxes right here in Brattleboro. Just think about this: if the schools, if everybody was already had insurance, and we didn't have to deal with that when we go and bargain with the unions and things like that. So politically, this is so huge. And like I've said a million times, I wish the people that disagree with me would at least come to the table. Let's try this way and see if it works, because the way it's working now, we can't control anything. It's just going crazy, and we're going to be a bankrupt country. Well, and we spend way more than all the other countries spend on healthcare with not very good results, Richard. It's not like the United States. One thing I always hear is how great, we got the best and yada, yada, yada. We rank 37th in the world. 37th in the world by all the major indicators.
So, but Daryl, let me ask you this. This is what I'm curious about is, what do you think's gone through Sheldon's head or his campaign in terms of just sticking hardcore to single payer in terms of numbers, in terms of support? Because, it's potentially...
well, it is.
So what do you think they're hoping for in terms of the vote, in terms of single payer?
Well, I'm hoping they...
No, not you. What do you think they're thinking? What do you think? Why are they latching on to this?
Because number one, I think Sheldon does have guts.
Yeah.
Okay. He does take hard issues. He's been working on this for a long time, so I got to believe this is something he cares about. Right. Although I'm sure he's well insured. And that's another thing. Here's a guy that he is probably taken care of. I guarantee you that.
Yeah.
And he's out there fighting for the folks that aren't. See, that's another thing that I've always been kind of leaning toward. I think his campaign knows there is such a groundswell of support, and this is an issue that really separates the two candidates. Like the one that you brought up, which did surprise me too. It's on his website. Yeah. It's not even on the other guy. So I think it's a time that's played out. He is not as he understands the implications of having a healthcare system that'll work for everybody, including business. If you have a healthcare system in the state of Vermont, I guarantee you it's going to grow business. I guarantee you that.
They'll be flocking here.
Hold me to that, folks, because there's no doubt in my mind we are going to have businesses come. How many social responsible businesses out there do you think there are that would look for that one thing and say, wow, Vermont, not only do they have a hardworking group of people there, beautiful environment and all this other stuff, they now have employee insurance. Wow, we want to go there and start our business. I'm telling you, folks, it'll happen.
I can see General Motors moving from Ontario to Springfield, huh?
They might.
Who knows?
You cannot rule that out.
Oh.
You cannot rule that out. I think that's a little
know.
bigger than what we're thinking, but you never know. Maybe it's a small little body a parts manufacturer that does one part. Yeah. We have a lot of that here.
Yeah. Or even a yogurt company,
That's right. Yeah. Maybe we get more foreign companies to come over here. don't you think if you went to Asia and said everybody, I think it'll be another tool in the toolbox.
Well, we can't
When you're
compete
out
with other
recruiting.
countries on healthcare because
We can't.
You know, all right.
They got it.
Let's while we're on this, I just thought, you know, how much we can keep talking about the governor, but I just realized that the single payer in healthcare is also an issue in the lieutenant governor's race. So, you know,
yeah,
so
you're not kidding.
let's talk a little bit about that because nobody ever
Richard,
talks about those guys.
You're picking the bigger races, and that's true, but healthcare is an issue in every race.
Well, it should be.
Okay, I guarantee you almost every candidate out there has
Right.
got to be talking about it one way or the
Right.
other.
But let's look at the next level because, you know, nobody pays attention to lieutenant governors.
No.
And I have my biases, but so we get on the Democratic side we have Steve Howard
Steve
from
Howard.
Rutland, who's a former legislator, or is he still a legislator?
Still.
And Phil Scott, who's a senator from where is he? Senator?
He's a senator from Washington County.
And Phil Scott, what he has going for him is he's a NASCAR driver. You know, that's probably bigger,
Well,
bigger than any political issue there is in the world.
That's true, and when you travel the state of Vermont doing that right there, you do have some fans. Personally, I happen to like Phil Scott. I worked with him very closely. He was in the Senate on institution. I was in the House. I found him to be smart, articulate, but wrong
So
on a couple of issues.
So what about health care? You must know their positions on health care.
Yeah, well,
So let's
he's
do
not
that.
exactly in the same boat that we are.
He's a free market guy.
Of course he is.
All right.
He's a businessman too, which I don't understand
What
how
kind of
some of these.
business does he run?
He runs a construction company. So I you know, you could under what we'd like to see, all of his employees would be taken care of, especially in the construction field. How nice would that be? But he's got his reasons why he's not a
Well,
big supporter of that.
Well, I might be wrong, but you know, and I shouldn't say this, but I will anyway.
Yeah,
I think a lot of
our show.
construction companies hire people as, you know, subcontractors,
Sure.
and then they don't have to
Worry
pay
about it.
insurance,
That's
and
exactly
they pay
right.
insurance on a very small number of employees.
And the more subcontractors they have working, is the less amount of workman's comp they got to pay because
Right.
they don't have to deal with the
Right.
workman's comp issue, which is also a big issue in the state of Vermont
But it-
and with businesses.
But it's sort of the same attitude as like, I got mine, and so the hell with everybody
Yeah,
else.
well, there's a lot of people
But-
that have that.
But now Steve Howard, recently I just noticed that he's coming out and saying a lot about single payer and making that part of his campaign.
Yeah.
So tell us about Steve a little bit. You know him.
Well, I first met Steve. He did a lot of advocacy work for the Westgate Housing Inc. was when I first met him. So he's a guy who cares. Well, I'm not saying none of the other ones do, but I mean they all care. It's just who do you care for? He's more of the type of guy that, to me, is looking out for the people that don't have that voice. And he has been in the legislature off and on for quite some time and has been a supporter of single payer. His record shows that. He's voted for it in the past, or at least, you know, parts of it. So, you know, I would say I'm glad he's talking about it now. He's been down here a lot. Mostly he's talked about VY. But now that is an issue that he's starting to pull out and talk about more, because there again, it shows the difference between him and his opponent.
And you got to, I mean, tell me what you think of this too, politically. The more that Steve Howard and Shumlin start saying the same things, you think that's better for him or not better? I don't know.
Well, I think it's better for him. And I think it's better for him when we're doing shows like this to show their support out there, that there's people out there that do support what they're saying. I know that single payer scares people because they think, oh my God, the government takeover, you're not going to be able to go to the doctor you want, they're going to force us into everything. That is so far from the truth. Folks, we have doctors now that are spending too much time trying to chase the money. We have a staff at the hospital now that is growing unbelievable. I think it's a staff of 20 now that runs in the business office now, and most of that's to go chase your money. Single payer, easy. The forms are the same. I mean, the money you could save just in the administration of it alone is phenomenal. I don't even know what the figure is anymore. That'll be something that I'd like to see when the report comes out, because the last figures I knew were 10 years ago and they're old, and I'm not even going to say them. but it was a very significant amount of money. So I'm glad Steve's also talking about it. I hope more House candidates, Senate candidates. I did an interview with Senator Jeanette White for Windham County. She brought it up a little bit. So I think, well, for people who have wanted single payer, I like to call it self-insured to not scare people. This is an opportunity we've been waiting for. For me, I mean, I'm waiting for a governor who will support it. I'm hoping we have a Senate that will support it. And I'm hoping that we have a House that will support it. And they can really work hard and come out with something that a lot of Vermonters are waiting for.
And let's back up a little, because you've been making reference to the study, but and I know we talked about it in
our last
previous
you
programs,
gotta watch it.
but it doesn't hurt to mention it again. So
yeah, we probably should. A couple minutes, go.
Yeah, let me just give you the rundown again. The state of Vermont, through the Healthcare Reform Commission, hired Dr. William Shao, an economics professor from Harvard, to do a study of Vermont's healthcare and come up with 3 approaches for reforming the system: 1 single payer, 1 a public option, and a third of his choosing. That report will come out in January. So clearly, whoever, not only in the governor or lieutenant governor, but every office, all the way from the Senate down to the House, the composition of those bodies in those positions will determine what happens to this study. So what does that mean? It means that in January, when the study comes out, if Brian Dubie's governor, and this is just my opinion and just speculation, but based on his approach to health care, let's say the legislature doesn't even adopt a single-payer approach, say they adopt a public option approach. Well, then they come up with a bill based on that. You can almost put money on the fact right now that Governor Dubie would veto the bill, and getting a veto override on something like that would probably be nearly impossible. And he'll probably veto any change in the system because clearly he doesn't believe there's any problem. If he did, it would be an issue.
Yeah.
So for him, it's not an issue. Now, if Peter Shumlin's governor, so Daryl, you can play out that scenario in terms of these studies. How do you think the politics of that would play out? Let's say the study shows that single payer is the most economically effective way to go, and that public option isn't too bad, and that he comes up with a third option, say like Germany, where there's a multi-payer system. What do you suspect Governor Shumlin and the legislature might do at that point?
Well, I think Governor Shumlin would bring his kitchen cabinet to the table, which is the higher level of leadership, and discuss their move, which I believe would be, okay, we have an opportunity here in Vermont. Let's go with a single payer option. And I think Shumlin would then work very closely with the delegation in Washington, which I also think plays a key role. He's got that relationship. He's worked very well with Congressman Welch. He's worked with Leahy before and Bernie Sanders. He knows the health care in and outs. I think I would feel more confident that all 3 options would be definitely checked out with him in there, and that the public option or a single payer would not be kind of discarded and just go for the business opportunity one, I'd like to say.
Well, and just to sort of reinforce that, on July 31st in Bellows Falls, Bernie Sanders was at a health care rally, and he made it clear. He says, if you people pass a single payer bill, and this is what he said, I will personally go to President Obama and ask him to push for the waivers. I mean,
that's big.
That's big.
And I think Obama was looking for something that, no, it doesn't, but I'm telling you right now, I believe that president is looking for this to happen somewhere too. Somebody wants something to happen differently in the healthcare system that we don't have now. Vermont should be it. We've done it before. We have never fallen off the face of the earth whenever anybody said to. When we've taken that step, civil unions, we're still here. Vermont's still running well. All the people wanted to take it back. You never lost it. I think the same thing would happen here. And it's time. Its time has come. We got to get radical, if you want to call it that.
Well,
I don't think it's radical at all. I think what we're doing now is radical.
Well,
when you got 50,000 Vermonters that aren't even insured, a bunch of other ones are underinsured. I mean, oh my goodness. And I've been saying this for so long, I'm actually getting sick of saying it. But anyway, our time's winding down, Richard.
How much time?
We got like a minute. So if there's anything else you want to say,
Well,
make sure that you go out, though, folks, and vote. Pay attention to the issues. It's coming up November 2nd. And one other thing I want to say really quick, for you folks in Vernon and in Guilford, I'm going to give my partner here a little bit of a plug.
So you can't do that.
Why?
You can't endorse anybody, can you?
We weren't going to endorse any of the other. Well, I'm giving you a plug. I'm not endorsing you. I can't vote for you. But what I would say is, if this study happens, you're going to want somebody who's been working on this for a long time up there that knows healthcare in and out, and that person is Richard Davis. So if you're in Vernon and Guilford, pay attention to what Richard's got to say about the healthcare issue. There's many other ones out there. We're going to have another talk with you hopefully next week. But anyway, Richard, finish it off.
Finish it off. So it looks like the whole country's looking at Vermont, not just in terms of, they're looking at us in terms of this healthcare study, but they're also looking at us in terms of the governor's race, because they figured out that if Shumlin wins the governor's race, then that's the best hope for implementing some of the pieces of the study. So I've been getting calls from people all over the country asking me what's going on. And to tell you, back when we had, during the primary, when Matt Dunn got mad at Peter Shumlin because he wanted to take the claim for being also a single-payer supporter, I was getting calls and emails from people around the country. They were like so jealous, like, oh my God, you got candidates fighting over who's the best single-payer supporter. They couldn't believe it. So anyway, I just mentioned
we will be the model for the state of Vermont. We will set the country forward. That's right, and we will set the model for the country to move forward. Richard, our time is up.
Let's finish up.
So I guess you got to say goodbye to everybody, and we hope you enjoyed the show.
Yeah.
Watch us again on the next healthcare update, where we will actually be talking probably about healthcare now again. Yeah. But we thought this was important. The election is important, folks. Pay attention to what's going on with all candidates, okay? And thank you for watching our show.